Hello, welcome to International Pathology Day. I'm Jo Martin, I'm past president of the Royal College, and we're going to show you some of the amazing developments in the pathology portal. So the pathology portal is an adaptive learning platform that we've developed to help our pathologists, our healthcare scientist colleagues learn from the new technology we've got available through digital learning. So what we've done is we've created a platform with trainees and with colleagues that will help us all learn. It includes questions, it includes comments, it includes context as well for particular cases. It's a new way of presenting digital learning material, and will eventually build up to cover the whole of the curriculum across all of our disciplines. So I'm going to share my screen now and show you in practice how this will happen. And this is live, and it's with the current version of the pathology portal. By the time you see this, there'll be new modules up. By the time you see this, there will be new technology advances on the platform as well. So it will have adapted. There are new developments going on the whole time, and it's getting better and better and better. So enjoy. I'm going to share content now, and I'm going to share my screen and show you exactly what happens as it happens live. So when you go live, you go into the Learning Hub. This is the NHS Health Education England Centre. And this will be accessible from the Royal College website directly with a single sign-on. When you sign in, the first time you go, you create an account. I can sign in here. So when you sign in, it can remember your account, and you can come to this page. And this is the opening page of the Learning Hub. When we type in here, we type in pathology, and you will see our catalogues come up straight away. Now these are here. So we've got the hematology and histocompatibility, cell path, infection and immunity. And on the next page, we also have clinical biochemistry. So I'm going to go into the cellular pathology specialties one. I'm going to press on that. And here is our banner, and we can search for particular items here. There are some elements here which are related to documents, which are key documents that you should know about. So this is Pathways for Diagnostic Cytopathology, and this is absolutely key guidance that you should know about. This is all part of your learning. But some of the more exciting areas here are, for example, this is a cytology case, and this is a fine needle aspirate from a thyroid. This is a simple image-based one for a new trainee or somebody beginning, and we've got an image there, and then we've got questions. So what does the upper arrow indicate? So that's this one here. And then you can answer. And this will be, what do you think that cell is? And if you think it is a benign follicular thyroid follicular cell, you would answer, and you'll get a little rosette and some feedback here. When you go on to question 2, so what does the lower arrow indicate? And if we go back and remind ourselves on the lower arrow here, what does the lower arrow indicate? That indicates red blood cells. And there we go. So we've completed that, and this completion, my completion of that, will be recorded on my learning document here. And you can see that I have completed this particular learning one. And you can generate a report that you could go for your appraisal or your review. And now I'm going to go back to the cases. So The other nice element to this is that we've got a whole range of different cases, a different learning materials. I'm going to select histo here particularly, and I'm going to go to, let's say, histo skin. And this one shows the medium power image of skin in the axilla. It's from a 25-year-old female, and what's the term for this here? And this would be acantholysis. Submit that. And then it will give you some pictures here and some feedback. If you continue to the next page, you can actually, it's given you a link into some further reading about pemphigus and acantholysis there, about the clinical details. So this is the power of the portal. The other amazing thing that you can do here is we're going to go to the next set of search results, and we'll show you cases where we've got a mixture of a journal article. So you start off the module having a look at the journal article. You can read that. Then you get asked, what are these particular bodies? Sometimes if you get the question not quite right, it will tell you that, and you can go on from there. So we're going to try again. This one, it's polyglucosan bodies. And then you'll get some more information about the electron microscopy. You'll get asked about other elements, and you can go on learning through a whole series of cases of learning. I'm going to go back now to cytology and show you another feature of the pathology portal here. And this is the whole slide imaging. So this is a whole slide image case. And as you can use either your fingers or you can use the keyboard to expand, I'm going to hide the controls there, to expand up. And then you can screen the sample as you would do normally. So we can see the whole slide image at a higher magnification, and the bottom right here you'll see where you are on the sample, and you can examine that, and we can ask questions on that as well. So this copes with whole slide images, it copes with journal articles, and there's a range of amazing experts loading up material as we go. And you also will be able to add contributions to this that will be reviewed by the editorial team. So on my contributions, published, oh no, it's not in the community ones, it's in the cellular pathology. Here we are, so I've put 165 contributions up here, including that rectal one. And you can see that we've put lots of cases up here, and that will also go on your learning record, so you'll get credit for doing that. You also get credited when you're viewing it. You'll be able to see who's authored it, and you can reserve the rights to it, so you keep the license on materials that you credit. So that's a brief summary of the portal. So we hope that you're going to enjoy this. The college has been incredibly supportive, and Health Education England and our partner organisations across the Pathology Alliance have been fabulous supporters too. We've got a huge range of really brilliant experts contributing to the portal, and they're all having fun bringing their cases. It's very easy to upload cases. It's very intuitive. And we hope that it will grow and grow. And as the editors allocate cases to particular levels, we'll get to the stage later, probably in the year or early next year, where we can allocate cases to particular learning levels, particular curriculums, and we'll be growing the curriculum across all our disciplines. So I hope you have a fantastic International Pathology Day, and we wish you all the very best.